Welcome back. The U.S. Food and Drug Administration now allow certified pharmacies to dispense abortion medication to people who have a prescription. The change could expand access at both brick and mortar stores and online pharmacies, making this a huge step in the journey toward access to reproductive health. Dr. Kristyn Brandi, a Darney-Landy Fellow from the American College of Obstetricians and Gynecologists, joined me to discuss this. Dr. Brandi, thank you so much for joining me.
Thanks for having me.
Now, I want to jump right into it. Can you just talk about, what could have sparked the FDA to make these changes to abortion access?
Well, I'm really glad that the FDA has made this change in the way that they regulate mifepristone. It's something that has a long history of evidence that shows that this medication is safe, it's effective, and that the restrictions that it had around mifepristone, how it was dispensed, who could dispense it, didn't actually improve any safety. This announcement was actually announced in December of 2021, but it's now coming into effect. And I'm really excited to see what it does to improve access to patients.
Now, also want to make sure that everybody understands this because when we hear pharmacies, people often do think of maybe, a chain pharmacy like Walgreens. Does this mean abortion pills will now be available in pharmacies like that?
Yeah, it does. Although it's unclear exactly which pharmacies will choose to hold this medication, essentially each pharmacy will have to go through a process to get approved from the FDA. And Walgreens and CVS has already announced that they are going to be going through the process to get that approval so they can dispense this medication. But other chains like Walmart and others have not yet announced what they're going to do. And so while it's going to be available much more readily to a lot of pharmacies in your community, it's unclear exactly if it'll be every pharmacy or certain pharmacies.
Now, will the distribution and sale of these products be similar to Plan B?
Not exactly. I do want to note for people that are watching that there is a difference between Plan B and mifepristone or medication abortion. I get that question all of the time. And just so that's clear, Plan B is emergency contraception. It's something that prevents you from getting pregnant, versus mifepristone or the abortion pill actually ends a pregnancy if you are pregnant. And so Plan B won't impact a pregnancy if you're already pregnant. It's important to also understand the difference now in these two medications because Plan B is over the counter. You can get it at any pharmacy. It's something you don't need a prescription for. But mifepristone still requires you to get a prescription from your doctor, from your clinician. And so it's important for people to know that you can't just walk into a pharmacy right now and be able to buy this medication. You still have to be evaluated by a clinician and get a prescription.
Now, thank you so much for clarifying that because I definitely don't want people to think that they can, as you mentioned, Plan B is over the counter. So it's definitely clear to make that distinction that this is not something that's over the counter. You still need to go to your doctor. Am I correct?
Right. And so the evaluation part hasn't changed. People still need to go see a clinician, and that can be either in person or it could be through telemedicine. But you need an evaluation to make sure this medication is safe for you, that it's appropriate for your, depending on how far along you are in pregnancy, and to go over risk and benefits, just like you would for any other real medication.
Now, what was the process of obtaining abortion pills like before, we've heard about this change?
So the process was very similar at the beginning part of it, meaning that you still have to go see a clinician. Again, either going to a clinic, going to a hospital, or using telemedicine as a way to talk to a clinician. They would go over your history, go over your risk factors, and talk with you about the pros and cons about whether or not medication abortion was the right choice for you. The difference was in order to get the pill before, you had to go either in person to this clinic, and actually in the past, you had to have a clinician actually watch you take the medication in person,
Wow.
or you had to wait for a particular pharmacy or that clinic to mail you from their own stock their medication. And so that could take a couple of days, potentially weeks, to get it mailed to you. The change now is that you can get it just like any other medication your doctor can prescribe you. You can get it prescribed to your local pharmacy and pick it up whenever you're ready.
Wow. So I can already see how much that's going to benefit so many people. Now, I understand that this change would allow, as we mentioned, local pharmacies to stock these pills once they go through a certification process. Can you talk about that process and why it's necessary?
Sure. So the process is actually similar to the process that doctors have to go through to be able to prescribe this medication. The FDA has created certain rules where you have to be able to describe how you will hold the medication, how you'll store it, Do you know which patients are able to get this medication or not? Often there's a screening process on the clinician side to make sure that you can identify how far someone is based on their pregnancy, and also if the pregnancy is inside the uterus or an ectopic pregnancy outside the uterus, which this is not a safe medication for that purpose. And so, unfortunately, this is potentially an onerous process. It can take a couple of weeks, potentially a couple of months to go through this screening process. And actually, they've shown that there's good data that this doesn't actually improve the safety of the medicine. The medicine's already incredibly safe. But unfortunately, due to abortion stigma, there's been a lot of red tape around being able to access this medication. And I'm really excited now that people will have a little bit easier access to it.
Now, Americans saw the overturning of Roe v. Wade last year. How will that affect how these pills are distributed across the country?
That's a great question. And I know a lot of people that may be in other states where abortion is restricted may be thinking that now they may have access to this medication. And unfortunately, that may not be the case. In places where abortion is not banned, this will help improve access by people being able to pick it up at their local pharmacy. But in states that have rules that ban abortion or ban the use of telemedicine for abortion, this unfortunately won't change their access, that they won't be able to get this medication in the same way. So it is helpful for a lot of people, but there are still a lot of people left behind, and there's a lot of work we need to do to make sure that there are rules in place so that those patients can also access the care they need.
Now, can you talk a little bit or expand on some of the work that you think needs to be done to help those who may still not have access? Because I think that, just as we saw what happened last year, it's so important to not get used to, how things are. So, what work do you think needs to be done?
Absolutely. And there are a couple things that we can do. It should be noted that there are some states that, even though the FDA has overturned these rules and how it regulates this medicine, there are states that have passed laws saying that you still have to come in person. You still have to get it at this clinic versus getting it prescribed to you. And so we need to work within those states to overturn those rules so that patients can access telemedicine just like they can anywhere else. I don't want my patients and for patients across the country for their care to depend on their zip code. And so thinking about ways we can help making sure that states have access, potentially even having a federal law that allows people to access medication abortion through telemedicine now that we have the ability to prescribe it. I think that would be a great next step. So there's still a little bit of work to do.
Now, prior to this change, the FDA limited this type of distribution of abortion pills due to safety concerns. Now, I just want to talk about, what was the FDA concerned about?
Sure. On face value, the FDA expressed concerns about whether or not providers could identify how far along someone was in pregnancy and whether or not this was an ectopic pregnancy, a pregnancy outside the uterus. Um, However, there's tons of data out there that suggests that these additional steps and the red tape that they created around this medication doesn't actually improve the safety of medication and how patients and doctors use it. And in fact, this exact same medication was able to be prescribed for other types of conditions, not abortion. And so it suggests that really abortion stigma was the core reason why all of this red tape existed. And I'm glad that we're starting to peel away.
Now, your organization announced that this was an important step forward. Could you just expand, on what this means for so many people who now have access or who now have this access?
Sure. Yes, I'm part of the American College of Obstetricians and Gynecologists, or ACOG, which is a group that supports doctors across the country, many of whom were unable to provide this care because they couldn't stock this medication in their own clinic. And so now that they're able to go through this process and be able to prescribe it, a lot more doctors will be able to provide this care to patients, and meaning more patients are going to be able to access this care that they need. I think particularly we need to name the fact that a lot of these restrictions that are now overturned will allow people that otherwise didn't have access to this care. People that, couldn't take off work to get to a clinic, who during the time of COVID may be worried about seeing and interfacing with people in person. And so I think that this is going to be able to make care more equitable and more accessible to a lot of folks.
Now, I also want to touch on the fact that, as we mentioned, is mifepristone. Is that the only pill that will be available in pharmacies?
So mifepristone is one of two medications that you get when you're undergoing a medication abortion. And so all of the talk that we're talking about today is related to this pill, the mifepristone pill. Misoprostol, which is the other medication used in abortion, has already been available in pharmacies for a long time. Although it is used off-label for abortion care, it's also used off-label for most of the uses that or that misoprostol is accepted and medically used for. So now we'll be able to have both medications be able to be prescribed, which is the evidence-based standard of care way for people to access medication abortion.
Now, can you just quickly let us know, what are some services your organization provides in regard to reproductive health?
Sure. So ACOG is a member organization. It serves about 65,000 OBGYNs across the country. Things that we do are provide up to date clinical guidance for physicians to be able to know what is the standard of care in OBGYN practice. We also provide resources to patients. So if you're looking for evidence based information, you're not sure exactly where to turn, you can always go to the ACOG website and get information. And we are trying to improve care across the country by advocating that care should be evidence based, it should be patient centered, and really helping to improve access for the people that need it.
All right, doctor, thank you so much for joining me.
Thanks so much for having me.
To stay connected with the American College of Obstetricians and Gynecologists, please go to their website at www.acog.org. We have to take a quick break, but we'll be right back with more Open right after this.